The following information is from a naturopathic point of view. All information and views are intended for educational and informational purposes and do not replace the advice or care from your healthcare team. This is Tea Time with Dr. Danni, conversations for navigating holistic medicine and wellness. With your host, Dr. Danni, we provide a fun and insightful look at health and wellness with clear and concise information, helping you to make educated and empowered decisions about your healthcare options and your health. Now, here's your host, Dr. Danielle McDuff.
Hello, my lovelies. Welcome back to all of our regular Tea Timers. And if it's your first time here, we are so glad to have you with us. This is Season 1, Episode 5 of Tea Time with Dr. Danni. I'm your host, Dr. Danni. Grab your favorite cup of brew and join us in the parlor while we take a dive into the field of holistic aesthetics and all of the benefits of working with an esthetician with our guest, licensed esthetician, Mikal Mimo.
For our first-time listeners, I am a board-certified naturopathic doctor, direct entry midwife, author, and now podcast host. I've been in natural medicine since 2011, and I began speaking and hosting live workshops on personal wellness and natural medicine that same year. This podcast is all about inspiring and educating our listeners to empower you to take the lead in your own health and wellness journey. Before we get into today's episode, I'd like to give a shout out to our sponsor, Mussler Chiropractic and Wellness in Boardman, Ohio. As a one-stop shop for drugless care and holistic wellness, Mussler Chiropractic and Wellness offers chiropractic, sports physicals, massage, naturopathic, traditional midwifery services, and more. Check them out at www.musslerchiro.com. That's www.musslerchiro.com. You can also find the link in our show notes.
Did you know that aesthetics is not just about chemical peels or microinjections or superficial services, but actually encompasses a vast range of support and care options to address a full range of skin issues? Our guest today is licensed esthetician Mikal Mimo. Mikal is a passionate advocate for holistic health and wellness. She's been a licensed advanced esthetician and osteology instructor in the state of Ohio since 2017, where she specializes in organic and sensitive skincare. She also holds certifications in microdermabrasion, Aveda, spa rules, and makeup coaching, chemical peels, as well as being a level 1 and 2 Reiki practitioner. She also holds certifications in group fitness instruction and Zumba fitness, and she's been facilitating group fitness classes since 2011. Her private practice, Guided Compass Holistic Health, is in Youngstown, Ohio, and will be celebrating 5 years of service this November 2025. Today, she and I will be exploring the applications of osteology from a holistic perspective, sharing how her field fits into collaborative care, and sharing some little-known facts about the field with you. So grab your favorite cup of brew and settle in as we dive into this journey. Mikal, welcome to the show. Thank you so much for joining us today. You and I had this great conversation when we were preparing for this episode, and you have such an interesting story. I was wondering if you would share with us what got you into this field.
Yes. Well, firstly, Danielle, thank you so much for having me. I am so glad to be here and so glad to be on your podcast.
Thank you.
Super cool, so thank you much. I feel like my journey, as the journey of many people with holistic living, begins out of personal need. For myself and the people that know me personally, my skin is incredibly sensitive. I grew up following the standard American diet, living a standard American life, and I had standard American problems. I feel like for myself, I have chronically sensitive skin, and that's something that I've been dealing with since a young lady. And for myself, as I got older, I became less and less impressed with conventional treatment options. And it was only for myself out of extreme need, where I was having extreme skin sensitivity, where I was itchy to the point where I was bleeding and I was feeling bloated and uncomfortable in my body. I was like, there has to be another path. I can't spend any more money on skincare products from the drugstore that don't do anything for me. I can't keep eating food that's going to be making me feel this way. There has to be another path. At the time, I was in high school, and this was back. I was in high school, and I came across a book about veganism for an assignment that I was given in school, and that kind of began a journey. I went vegan overnight just for this research paper that I was doing for school, and that began a lifelong love of food and wellness. When it comes to my relationship for aesthetics, I feel like aesthetics has been an umbrella for every passion that I've ever had. On my journey into veganism, I also stopped using conventional skincare products, and I began using only organic ingredients, simple plant-based oils, truly things that are skin food. And my chronic skin conditions started to clear up. I became more radiant and vibrational in my body. My energy started to shine, and I felt like for the first time I was really starting to live my life. So I'm so passionate about wellness because I personally have lived the benefits, and I've seen the way that my life has changed around it. And since, this was back in 2009 that I began walking this path, and ever since, my licensure within the aesthetics industry, my certifications and licensure with teaching group fitness classes, I feel like all of that has just been such an umbrella for me. Aesthetics, I feel like, came at a point where I wanted to take my knowledge of self-care for my own body deeper. And me stumbling into an aesthetics program is a story for another time, but I feel like aesthetics has been so healing, and my passion that I work within my industry to do is to help other people find true health in their bodies. There are many different approaches to health, and there are many different approaches to skin. And Guided Compass Holistic Health, which is my practice, I feel like that's what we talk about. We talk about comprehensive holistic care with mind, body, spirit, and I feel like that fits in so perfectly to your field as well. And I'm so very glad to have an opportunity to talk about this with you today.
Yeah, I'm excited. When you and I talked on the phone to prepare for this, there were so many things that I didn't realize estheticians did that help people in that way, to help them reach goals. I mean, everyone wants to look good, right? We want to feel good in our skin. And part of that is when we look our best. There's a huge difference when we put on, a sloppy pair of sweatpants and a sweatshirt, and like how we feel and how we move and how we respond to when we put on like our favorite pair of jeans and the shirt that we feel smoking hot in, and do our hair and our makeup, right? Like there is a correlation between how we emotionally feel and what we project in how we look. So it all starts there. Now, you were talking to me about some of the specifics in your field regarding scope. And I was wondering if you would share for our listeners, what exactly is the scope of an esthetician? Like, what do you guys do? Mm-hmm. Right? Like, I could never answer that question, right? Like, I need a professional to answer that for me. So here you are. Share for us, what exactly an esthetician does, and maybe some of the things that our listeners might find interesting about the field.
Yes. I do feel like there's a lot of confusion about an esthetician's scope of practice. And I think what makes that so confusing is that licensure does vary from state to state. The state of Ohio has one of the strictest licensing requirements for the field of osteology. Estheticians, regardless of state, our scope of practice is limited to the beautification and application of cosmetic products, therapeutic treatments for face or body only. Practice for estheticians does vary state to state. So in some states, estheticians are able to do advanced procedures like microneedling or laser. In other states, estheticians are not able to do relaxation massage. The state of Ohio has one of the toughest regulating boards for the field of aesthetics. For an esthetician in the state of Ohio, our scope of practice includes facials, chemical peels, full body waxing, makeup artistry. We can also do things incorporating relaxation massage. With relaxation massage for estheticians in the state of Ohio, we cannot work over the neck or the cervical spine. And we also cannot do deep tissue. Estheticians in the state of Ohio, we are limited. We are not able to do any procedure that draws blood. We cannot do laser. We cannot do microneedling. We cannot do cosmetic tattooing or piercing. Something that I would like to share, I think, with estheticians is that there's also additional certifications that you can get in your field too, which can kind of give you a thumbs up or additional experience in specializing in a certain treatment or thing. But it is really important for anyone wanting to work with an esthetician to realize that they're not all the same. Some estheticians have an organic, holistic, full body approach like mine. Other estheticians maybe have more of a superficial mainstream approach, and that's fine. I think ultimately it's finding a complement to your individual lifestyle, to your individual skin goals, and ultimately how that provider, your aesthetic provider, is going to work in tandem with your other providers as well to help you get the most optimal path to health.
Awesome. That sounds so much like what I have shared with the listeners before about paying attention to practice model. Particularly in the field of naturopathy, we have Some practitioners have a very product-centered practice and others not so much. And so you really do need to know what your goals are and what you want from your team so that you can go and ask the right questions. And it sounds like that would be the same thing then with osteology.
Absolutely. I feel like with aesthetics, truly your esthetician is only as knowledgeable and good as the education that they receive, and they also continue to acquire. The field of aesthetics is always evolving and changing. And I think something that's so important about finding an esthetician is finding someone who's really committed to staying educated and doing the work to continue to grow. Because different skin types, tones, and textures, different seasons of life, whether we've been through menopause, whether we're going through chemotherapy or radiation treatment, whether we're going through pregnancy, whether we're going through traumatic loss or stress, all of these things can affect the skin and the body internally and externally. And it's finding someone to help you navigate those changes, I think, is key, rather than taking a cookie cutter approach to treatment, which is common in the industry.
That's so interesting. All of the different life stages that you mentioned. You mentioned about certain medical conditions and treatments that you might be going through, but you also mentioned emotional states for people. So talk to us a little bit about some of the things that you might see in some of those different stages of life. What might be some things that we notice when we've gone through a major loss in our life, or when we've gone through a major medical procedure? Mm-hmm. Just share with us some of your favorites.
Mm-hmm. I feel like that's such an interesting question because something that comes to mind is when a woman is pregnant, generally they'll say, oh, she has such a radiant glow. She had this aura around her. And I feel like the same energetic thing can come about when we're dealing with loss or trauma too. Sometimes if you've experienced loss or trauma or sickness, whether it's mental or physical body, you almost can have a grayness of your complexion, a sallowness to your energy. You could have a stagnancy in your body. You can have excess weight, water retention, puffiness, swelling, under eye circles. You can have yellowing of the teeth, yellowing of the eyes, or thinning of the skin, hair, and nails. Something that I think is really interesting too is the body does talk, and it's very subtle. And oftentimes the health of the skin and the hair that we're seeing on our body today is a reflection of the health of the hair, skin, body, and mind, 6 to 8 months prior to. Because our body on a cellular level is always growing and changing and evolving, and our diet, our energy, all of that plays a part into it. And it is impossible to have a radiant, vibrant outside if we don't cultivate a radiant and vibrant inside. And I feel like that's where the field of holistic aesthetics comes into play, because that's what we do. That's what we talk about. And ultimately, we're trying to encourage our patients and our clients to come up with care teams to get them the best possible care so they can live the healthiest, most high vibrational life possible. And that's a multifaceted approach.
Yeah, very much so. And so what I'm hearing is that, these physical manifestations of that emotional state, they're not necessarily like immediate. Like sometimes we will see that come months after the event, even when the person is starting to recover.
Absolutely.
Wow. As a holistic practitioner, I understand that, from a physiological standpoint, but it hadn't really occurred to me that those emotional responses, yes, we have physiological responses to them, but it did not occur to me how that affects our skin and our hair and our nails during that time frame.
It's truly incredible. And I'll tell you, I've been, in my industry and licensed for 7 years now, and God willing, I'll continue for a long time. And I have seen so many things. And when you start to connect these patterns and these stories and work with these men and women over time, you really begin to see the way that energy, thought, lifestyle is cumulative, and how our health comes and goes in seasons. And it is a privilege to be in a position to be a provider, to walk with someone and give them guidance and give them nourishment and health. I think something with aesthetics, it has such a reputation for being a superficial industry. You're just doing makeup, you're just doing waxing, you're just doing facials. It is so much deeper and more intimate than that. Because how many times are you truly stripped, no makeup, physically, maybe no shirt, maybe no top, right, tucked under a blanket. You're truly being completely vulnerable with someone. And I feel like for those of the people who are like seeking holistic care, it's internal work too. It's not just external. It's truly very much a detox and a cleanse of the entire spirit, the body, energetically as well as physically. And having good providers to walk with you and help you do that is key. And I think that's the work that you're doing. with this podcast and wanting to create a collaborative care team and educate people on how and what and where to go to find these people. I think that work is so important because the more that people talk about this, the more available that it's going to be. And then together we can all rise on a path to vibrant health. And that's the goal. I think that's what we're both seeking to personally and professionally.
Yeah, absolutely. That is absolutely the goal within this particular series. I've worked my entire career kind of fighting against the good old boys club, if you will, that and even within the field of naturopathy, it's really hard to get another naturopath to collaborate. There's such a competition there, rather than recognizing that each of us, even if we're in the same field, we still bring something very unique to the table as individuals from our perspective and our learned experience and how we view things, that we can each as individuals learn from someone else. My grandmother used to tell me there's something you can learn from everyone, even if it's what not to do, right? And so I think taking that approach and recognizing that we're not competition, but we're simply individuals, hopefully striving for the same goal, right? To better our clients' lives and produce the best possible outcome from them as a team to help them reach those goals. That's absolutely the goal here. And it's so wonderful to hear that from other practitioners because it is few and far between. So it's an amazing thing. And I always learn so much from these interviews. They're not little, these interviews. I learn so much. I do know about the different industries and I do know some about it, but I learned so much more doing these interviews and getting that firsthand feedback and explanation of what's going on for different practitioners like yourself. And I mean, we have a whole host of practitioners coming on for this series. But I want to go back to what you were saying about it being vulnerable and that emotional stripping. Because this is the one thing that I have found absolutely true in everything that I have done is that when we address the emotional underlying components of what is creating the symptoms or disorder or whatever for that client, that client will heal faster and more completely than if we don't. Mm-hmm. So talk to me about what your experience has been with, are you finding that? What would you like to say about that?
I'll tell you, when you see it firsthand, the power of shifting that energy in the body and really beginning to watch someone heal and blossom, it's a beautiful thing to see. In addition to being a licensed esthetician and working within the holistic health industry, I also am an energy practitioner. I am a level 1 and a level 2 Reiki practitioner. However, I incorporate other therapies as well, aromatherapy. So I refer to my practice as energetic body work, and that is something that can be a really beautiful complement to aesthetic treatment, whether that is, a facial or a massage. When I think about energy, I think about it like a flowing river. And when we have blocks in this flowing river, these dams, energy gets stagnant. And when that stagnancy happens, we start to get schmutz, we start to get algae, we start to get stagnant water. And healing and vibrant life cannot happen in stagnant water. You've got to get it moving.
Yeah.
And whether we're detoxing the body through healthy food and supplements, whether we're detoxing the body through getting a skin detox body scrub, or we're doing a facial or extractions, whether we're doing energetic body work, I feel like all of these have a place in just kind of like pulling that pop on the drain and letting all that stagnant water flow so health and vibrancy can really come through. And that takes time to clear.
Oh, yeah.
And I think that's something that people don't always want to hear. I think something with a holistic approach, I think it's playing the long game. However, what I always think about for myself and for my clients is, none of us are getting out of here alive. So how are we going to maximize ourselves and our life living as vibrationally high as we possibly can with the tools and the circumstances that we've been given? Every day we are presented with choices where we can make ourselves better. And using estheticians, massage therapists, naturopath, we can, tools in the toolbox to help us live the healthiest life possible.
Yeah. Yeah, I agree. I love what you said there about getting the waters moving, right? Like we can't not in stagnant water. There is an approach, a teaching within Judaism that talks about living water. We have so many things, but one ritual in particular is the mikveh, and the mikveh itself. We get into that to kind of wash things away and recharge. And one of the things that's really important about that is that it has to be living water. right? It can't be a pool. It has to be natural living water. So rainwater. You could go to a lake, you can go to the ocean and do this mitzvah. And it is, it's, I've always been a water baby, so I'm drawn to this, but it helps to make sure that we are allowing that energy to flow out and then new to flow in and recharge us. And it's such a beautiful thing. I love how you said that. We have to take a break soon, but before we do, I would like you to talk to us a little bit about your philosophy of care and the role that you think lifestyle, or the importance of lifestyle in care.
So as an esthetician, my specialty is a holistic esthetician. Within the field of osteology, you have estheticians, advanced estheticians. Primary difference between the two in the state of Ohio is an advanced esthetician is able to teach through the Ohio State Board of Cosmetology, whereas someone who is just a standard esthetician is not able to teach. In my scope of practice, I specialize in holistic aesthetics, which is a holistic whole body approach to skin. Skin is a reflection of overall health. With holistic skincare, it's really important to address the root cause, not the symptoms. And I think that is the difference in my approach. The field of holistic osteology is not super popular. And I feel like the work, it's subtle, slow work. It's not quite the dramatic befores and afters that we're always seeing on Instagram or on Facebook. Holistic aesthetics is about true commitment, creating a long-term relationship, talking about how emotions, how lifestyle, sleep, stress, hormones, all of these things affect the skin. And I think it's really important as well to talk about, gut health. Internal inflammations, and all of these things feed into the type of practices and treatments that estheticians can provide, and the tools that we can use, whether it's massage and gua sha, whether it's, pressure point work, whether it's lymphatic drainage. I feel like there's so many things that estheticians can incorporate. They're a beautiful complement to health. And holistic aesthetics is very much a specialty within the aesthetics industry. And it's a field that, I hope will continue to grow, because I think the more people practicing this subtle work, I think it's going to really shift the way that people are viewing estheticians. It's not just superficial. It is so much deeper than that. And the work that we do on a physical as well as energetic level is very healing.
Yeah. And I think too, with the education and the expansion of that, or even just, bringing that into the mainstream, we also give people the opportunity to tap into resources they didn't realize they had before. It's a great approach, and not a lot of people understand the need for that approach to play the long game. Like I said on episode 2, it's not a one and done thing, right? Like, we're not going to get overnight results. And I think that's important in any kind of healing journey, regardless of the practitioners that you have on your team, is to understand that it took you time to get to that point, right? Yeah. And so you have to take the time to do the work to correct the underlying cause, which is great. You mentioned that yourself, that getting to that underlying cause rather than working on the superficial work. So talk to us just a little bit about what that looks like in your practice. If someone came in, first-time client, let's say, and they want to work with you, how do you approach that? Walk us through what that visit would look like with you.
Mm-hmm. So I feel like my approach to working with a first-time client would be dependent upon service they were getting. If someone was interested in relaxation massage to help manage chronic pain that they're dealing with, or maybe a deep tissue or therapeutic massage is not the move for them, or someone who has, excess acne or hyperpigmentation or scarring, whether that's on the face or body. All treatments in my practice begin going through a comprehensive health history and skin consultation. That process alone can take anywhere from 30 to 40 minutes. So first-time appointments, we're there together for probably a total of 2 hours, and that will include treatment time. Okay. It is really important, I think, for anyone getting aesthetic services to make sure that their licensed esthetician is asking them questions and doing a comprehensive health history, because how is your esthetician going to choose any skincare products, oils, or anything else that's going to help you get your skin where you want to be if they're not asking you about your skin and what you want to do with it? So in my practice, we start off with health history, skin analysis, and ultimately I will ask, usually pretty straight out, are you willing to commit? Do you want advice? Do you want recommendations for product, or are you just looking to relax? There's absolutely nothing wrong with wanting to come in and just take a good rest. I think facial naps are the best. If you know, you know.
Yes.
I think for someone who wants relaxation, they're going to get beautiful relaxation, rest, and great benefits too. But for the person who really wants to make it work and they want to do some work and achieve their goals with their skin or body, that begins with a really good conversation. And usually most of my treatments in my practice schedule for 60 or 90 minutes.
I have fun with people driving by in very loud vehicles because it's warm outside. All the motorcycles are out.
We have to take a quick break, but when we come back, Mikal and I are going to talk about some services commonly associated with osteology and how her practice differs from the mainstream of the field. So grab your favorite cup of brew and meet us back here in the parlor. We'll be right back. You're listening to Tea Time with Dr. Danni, conversations for navigating holistic medicine and wellness. Stay tuned. We'll be right back after the break. The Classroom, in collaboration with Dr. Harriet Lemberger Shore, is proud to present Introduction to Collaborative Medicine on August 17th from 9 a.m. to 4 p.m. at 755 Boardman Canfield Road, Suite C2, bottom floor. This retreat coincides with the kickoff of our 100-day challenge and will introduce you to the different aspects of collaborative care with breakout sessions on lifestyle medicine and vision setting, naturopathic medicine and nutrition, emotional healing and rebalancing, and the transcendence therapy, followed by activities and a cooking demo. A light breakfast will be provided as well as lunch following the cooking demonstration. The cost for this retreat is just $65 and registration is now open, but seating is limited. Registration closes August 12th, 2025. Call 330-758-9567 or text collab to 234-308-8289 to reserve your spot today. Are you in or near the Youngstown, Ohio area? Do you want to learn more about herbal medicine and how to make them? Then check out Dr. Danni's Deep Dive Herbology series in 2025. Deep Dive Nettle takes place June 19th and 26th at the Classroom located at 755 Boardman Canfield Road, Suite C2, bottom floor. This 2-day immersive class dives deep into the uses, properties, and ways to prepare every part of this incredible plant, often mistaken as a common weed. You'll learn the benefits of each part of nettle, receive hands-on activities for you to do at home, enjoy interactive classroom activities, and receive recipes and activities to continue exploring the wonders of the nettle plant. Just $90 covers both days and class supplies. Registration ends June 13th, 2025, so call today to reserve your spot. Call 330-758-9567 or text NETTLE, NETTLE, to 234-308-8289. Or check the show notes for registration info. For up-to-date workshop and appearance information, go to www.drdanninaturopath.com/education. Before we get into today's episode, I'd like to give a shout out to our sponsor, Mussler Chiropractic and Wellness in Boardman, Ohio. As a one-stop shop for drugless care and holistic wellness, Mussler Chiropractic and Wellness offers chiropractic, sports physicals, massage, naturopathic, traditional midwifery services, and more. Check them out at www.musslerchiro.com. That's www.MU, S as in Sam, S as in Sam, LERCHIRO.com. You can also find the link in our show notes. You're listening to Tea Time with Dr. Danni. This show was previously recorded. You can reach the show at drdanninaturopath@gmail.com. That's DRDANNI naturopath@gmail.com, or find the link in the show notes below. Now back to tea time. Here's Dr. Danni.
Welcome back to all you tea timers. Before the break, our guest, licensed esthetician Mikal Maimo, shared her story and we discussed her approach to care. We're going to jump in here and talk a little bit more about her practice. So in the last segment, we chatted about the scope of practice, in your field, which of course varies from location to location. The regulations vary from state to state, and even maybe from areas in that state as well, correct?
Mm-hmm. Yep.
So how do you become an esthetician? What are the options for learning here?
Mm-hmm. So for aesthetics, for the field of osteology, there are requirements that do vary from state to state. If someone wants to find out specifics of what their state licensing board requires for the estheticians, I would hop on Google and just do a quick Google search.
Okay.
Most of the time for estheticians, it will usually involve some type of theory portion of learning, which is traditional classroom lecture style. In the state of Ohio, there's a certain number of hours that are required to have not only in a classroom setting, but then there's also an hour requirement of practical hands-on in a clinic setting. All of that is supervised. In the state of Ohio, as far as licensure goes, there's two paths. Generally, it is in classroom education and supervised clinic work until you get a certain number of hours that you're required to have through the Ohio State Licensing Board for us. Once you have that number of hours, you are able to go take your test, and if you pass your exam, you become a licensed esthetician. Within the field of osteology in the state of Ohio, you can also be a licensed advanced esthetician. I am a licensed advanced esthetician. With an advanced licensure, there is additional hours and curriculum that need to be studied, as well as advanced patient care as well, and there is a separate exam that you have to take for that. Something that I think is really cool about the field of aesthetics in the state of Ohio, speaking to strictly, is that you can have two different pathways to advanced licensure. With your advanced licensure, you need to have so many hours working with clients. So someone might be able to bypass the education classroom setting if they do a certain number of hours of clinic work. And I think that's something that's really cool, because within the field of aesthetics, there are some things that really can only be learned through working one-on-one with a patient. And I think it can be really hard to connect that with a textbook. So something I really do respect about the Ohio licensure path for estheticians is that once you kind of get into the advanced licensure, they kind of recognize that you can either have classroom hours and classroom assisted, hours in that regard, or you can have, independent work working with clients, and then you can still go test. But I would definitely encourage anyone to ask to see licensure for their estheticians in whatever state they're in, what their credentials are, and also ask to see certifications for the treatments and devices that they're offering. Esthetician scope of practice does vary state to state, and there can be subtle as well as huge differences in that scope of practice. And at the end of the day, as someone who works in the field of education in the industry and also does a lot of corrective work, I have clients and patients coming to me who have had damage done to their skin and body, and they have semi-permanent scarring because they were going to an esthetician that was operating and doing services and using devices outside of their scope that they had no business using.
Yeah, okay, so that's a great segue there. What are some of the things that estheticians are not allowed to do?
Mm-hmm.
I know there's quite a few things that I had originally thought were osteology services, but in the conversation that you and I had, it turns out that they're not. So share with our listeners what some things are that you guys are not allowed to do.
Mm-hmm. So I'll be speaking specifically to the state of Ohio. This will vary state to state. In the state of Ohio, estheticians are not able to operate laser. Estheticians aren't able to do microneedling. We're not able to do dermal fillers, cosmetic injections, neurotoxins of any kind. Estheticians are not able to do deep tissue massage. Estheticians are not able to do trigger point therapy. Estheticians are also not able to do any scalp services. Estheticians aren't allowed to style hair or do anything like that. We can wax hair, we can dermaplane hair off, but we're not allowed to do hair braiding or shampooing or anything in that regard. Where that treatment would end with heat styling, using heat styling tools, that falls to cosmetologists. So estheticians, our scope of practice in the state of Ohio is truly limited to the application of cosmetic products and therapeutic face and body treatments to give an aesthetic result. Estheticians are not legally able to write prescriptions. We have no medical credentials. And I think that's a big point of difference. Estheticians can make recommendations for supplements and herbs to incorporate into diet and how to maybe shift lifestyle and diet around that, but we're not able to write prescriptions. We don't have medical credentials. And estheticians also, even with supervision, working under a medical director, are not able to do those things. It's not within our licensure to be able to make prescriptions of any kind.
Okay, now, and does that extend then to like injections as well?
Yes, estheticians are not able to do injections of any kind, even with supervision or working under a medical director. It's out of our scope. Estheticians, what I always tell my students when we're talking about this for the first time is our scope of practice. If you can pinch the top of your skin on the back of your hand, that's our scope of practice. If you get a paper cut and you draw blood, that's where our scope ends. Estheticians are not able to draw blood. We do naturally do some services like waxing, or maybe we're doing a pore extraction where we could get a little bit of blood, which is naturally going to happen if a follicle is opened up through cosmetic treatment. However, we're not able to do dermal injections, Botox or Dysport or hyaluronic acid fillers, simply because you're placing a foreign product deeper into the layers of skin that is outside of our scope. Our scope of practice includes the epidermal layer only, which is made up of 5 subsequent layers, but that epidermal layer is very, very thin, and all 5 of those layers, if you pinch the back of your hand, you're pinching them all.
Okay. Awesome. That's great information. All right, that was eye-opening. So what would be some of the lesser known services that you do provide?
So I feel like for lesser known services, estheticians where we shine, body scrubs and body wraps, body treatments of any kind, that is something that is in our scope of practice, which is phenomenal for a full body detox. Estheticians can do spray tanning, which is kind of different. We can also do a facial sculpting massage, which is a really nice thing to help sculpt the muscles of the face and upper body and décolleté. We can do custom herbal facials. We can also do some chakra work and energy work. That is going to be more specific to if you have a holistic aesthetic provider who is interested in those alternate modalities of healing. There are other things like access bars or energetic facelifts, which I feel like we're kind of starting to hear about. Whether or not there's efficacy behind those treatments, that's a conversation for another time. But it definitely is a treatment avenue as well. Yeah, I think body scrubs and body treatments are probably my favorite service that is not as common in the field of mainstream aesthetics today. I love doing body treatments.
Yeah. So you mentioned something really important there, and that is that not all estheticians are offering all of these services. So what would be some good questions for clients to ask when they are vetting an esthetician to find out if that practitioner is a good fit for their team?
Ooh, yes, I love this question. I would say ask for their licensure and their license number for the state that they're in first. First step with working with any aesthetic provider is you want to make sure that they have a license that is active and up to date. Usually with a licensure requirement through a state, there's a continuing education requirement as well. So you want to make sure that you're getting services done by somebody who actually holds a license, because unfortunately there are many people out there offering aesthetic and cosmetic services who do not have a license, they don't have health insurance, and it can be incredibly dangerous. So definitely I would ask for licensure first and ask where they went to school. And then if you have a specific treatment or goal you have in mind for your body, whether that's you want to treat acne or congestion, whether you feel like you have excess inflammation, maybe you have hair loss, maybe you have eczema or psoriasis and you have dry skin patches, maybe you have hyperpigmentation or melasma from pregnancy, you want to ask your esthetician specifically in that initial connect if they're able to help you with that concern. Some estheticians can and some estheticians cannot. And a good esthetician, if you ask them that question right away, they're going to either say, yes, I can help you with that. This is going to be my approach. Let me educate you on how. And a good esthetician, if they cannot, they're going to say, you know what, that's not going to be within my scope. But what I would love to do is I would love to get you to somebody who can. And I think that's where collaborative care in the field of aesthetics is so important. I oftentimes make referrals. I was telling you as we were talking earlier today, in my practice, in my private practice, I don't have any fancy aesthetic devices. I don't need them. My devices are my hands. However, if I have, a patient come and see me and they have a lot of detoxification to do, maybe I would recommend them to go see an esthetician who offered like a hydrodermabrasion to get their skin at a point first where it was free and moving, and then bring them back to me so I can continue on with care. So there's definitely a lot of room for collaboration within the field of aesthetics. And I think for a holistic approach to skincare and body care, that is so important. You want to make sure that you can get the best of it all by asking good, honest questions right away.
Yeah, and I think that's true with interdiscipline care as well, that if it's something that you have a client coming to you with a concern and you're like, look, this is what I can do to help. However, this is the level of results that we're going to get if we included this sort of service or this particular discipline in conjunction, then these are the results that we might get. It does work pretty synergistically within the different disciplines. So yeah, that's really important. So I know we've talked so much about your practice and how your approach maybe is not a widely used one in the aesthetics field, but can you break down like your elevator speech of how your practice is different from your colleagues in your field?
Sure. I feel like if I had to say what made my practice and my approach different, it's whole body care. You know, when someone comes into my office, like, I want to know how they're doing emotionally. I want to know how they're feeling embodied in their physical body. I also want to know what they're eating. I want to know how many cups of coffee they've had. I want to know the water they do or do not drink. I want to know about the products they have in their bathroom, whether they use them or they don't. I want to know about all the treatments that they've tried and unsuccessfully had results with, or the treatments that they've had where they've really had amazing results. I think my approach is different because I give the time. I am someone who loves to receive the same services that I perform, and I have had so many services where they have me come in, fill out a piece of paper for 2 minutes, watch me sign my name, ask me one question, which is if I have any allergies, and then invite me to undress and get on the table for a treatment. They don't ask me about my diet, they don't ask me about my skincare, they don't ask me when the last time I exfoliated was, nor do they ask me if I have any sensitivities, which I do. So I think what makes my approach different and what makes the field of holistic aesthetics so necessary is that there is a whole group of people who are striving to have healthy skin, not perfect skin, healthy skin, because our skin is the only outfit that we wear every day that we don't get to pick out. So in the same way that we invest in a beautiful leather bag or beautiful clothes, we need to invest in our skin and our wellness with the very same approach, and that's what I do with Guided Compass. I provide the same treatments that I wish I could have had when I was a young lady.
That's beautiful. Okay, we have to take another short break to hear from our sponsors, but when we come back, we're going to discuss collaboration and a unique service that Macau provides to a specific segment of our population. So refill your cup and meet us back here in the parlor. We'll be right back.
You're listening to Tea Time with Dr. Danni, conversations for navigating holistic medicine and wellness. Stay tuned. We'll be right back after the break. Before we get into today's episode, I'd like to give a shout out to our sponsor, Mussler Chiropractic and Wellness in Boardman, Ohio. As a one-stop shop for drugless care and holistic wellness, Mussler Chiropractic and Wellness offers chiropractic, sports physicals, massage, naturopathic, traditional midwifery services, and more. Check them out at www.musslerchiro.com. That's www.musslerchiro.com. You can also find the link in our show notes. Are you noticing hair thinning, experiencing constipation, sensitivity to temperature changes, or rapid or irregular heartbeat? Have you noticed moodiness or unexplained weight gain or loss? Are you looking for a natural approach to healing and not getting answers elsewhere? Dr. Danni can help. As a board-certified naturopathic doctor, her client-centered approach will help you discover the underlying contributors to your symptoms, learn how to better support your body, and provide you with resources to help you speed your healing. Schedule an assessment or ask for the free 10-minute Can You Help Me consult to find out how Dr. Danni can help you. Call 330-758-9567 to schedule today. Are you in or near the Youngstown, Ohio area? Do you want to learn more about herbal medicine and how to make them? Then check out Dr. Danni's Deep Dive Herbology series in 2025. Deep Dive Nettle takes place June 19th and 26th at the classroom located at 755 Boardman Canfield Road, Suite C2, bottom floor. This 2-day immersive class dives deep into the uses, properties, and ways to prepare every part of this incredible plant, often mistaken as a common weed. You'll learn the benefits of each part of nettle, receive hands-on activities for you to do at home, enjoy interactive classroom activities, and receive recipes and activities to continue exploring the wonders of the nettle plant. Just $90 covers both days and class supplies. Registration ends June 13th, 2025, so call today to reserve your spot. Call 330-758-9567 or text NETTLE, NETTLE, to 234-308-8967. 8289, or check the show notes for registration info. For up-to-date workshop and appearance information, go to www.drdanninaturopath.com/education. You're listening to Tea Time with Dr. Danni. This show was previously recorded. You can reach the show at drdanninaturopath@gmail.com. That's DRDANNI naturopath@gmail.com, or find the link in the show notes below. Now back to tea time. Here's Dr. Danni.
Welcome back, my lovelies. I have topped off my cup of brew. I hope you have too. Now, before the break, we discussed the educational options for aspiring estheticians, some common services that were provided, and some things that maybe were unexpected services within the field of osteology. And Mikhail shared how her practice differs from many of her colleagues. So when you and I were chatting about your practice, you shared this very surprising specialty work that you do in your practice that we're going to share a little bit later. But before we get into that, I'd like to get your take on interdisciplinary collaboration. What does that look like for you, and what are some important factors to you when you do get into collaborating with another practitioner?
Ooh, yes. I feel the thing that I am looking for at that initial connect is the willingness to invest. I think when you are trying to come up with a collaborative treatment plan for someone, it's really good to see how willing is this person financially, with their time, emotionally, willing to invest on this journey. There have been times where I will, decline an opportunity to work with someone because I feel like they're not willing to do the work that's needed, and ultimately, financially, it would be a waste of a commitment for them. So I really think getting clear on someone's willingness to invest and the want to change is key, because you can lead a horse to water, but you can't make them drink. And I think something for the field of aesthetics is the work that we do in the treatment room is going to be phenomenal. You're going to get great results, but it's the work that you do in the 4 to 6 weeks in between your appointments with your aesthetic provider where those shifts for skin and body health is really going to take place. So it's really difficult to lead someone if they're not willing to invest. So that would probably be the thing that I look for first, as well as the willingness to incorporate lifestyle shifts that are suggested. If I have someone who is, their primary focus is wanting to treat acne or texture, and they have got a lot of inflammation in their diet as well as in their lifestyle, if they're not willing to make lifestyle shifts away from inflammatory foods like gluten or refined sugar or dairy, as well as maybe incorporate stress management, it's going to be really difficult to treat acne or texture, because again, we have to address the root cause and not put a band-aid on the symptoms. And with a conventional aesthetics approach, which is all about skincare and product focused, it's putting a band-aid on the problem. And it's no wonder when people are using skincare products for such a long time, the moment that they stop using this product or run out, the issue comes back. It's because that product was putting a band-aid on the issue and not treating the root of the issue. And that's where a holistic esthetician's approach is different.
So how does that come into play then if you are looking at bringing another practitioner into the game, to help that person? There's something there that's clearly outside of your scope, and there needs to be collaboration, not only with the client. I mean, clearly the client needs to be the main collaborator, but also with another practitioner. What does that look like for you?
I feel like the willingness to communicate. I feel like having a practitioner who wants to collaborate and who is open that their approach or their scope isn't the only way. I think sometimes when it comes to the holistic side of skincare, whether you're working with medical practitioners, whether who is an aesthetic nurse, someone who's offering treatments like microneedling or PRP injections, I think it's really important to be working with another provider who is open to collaboration and who wants to talk. I think that so many of the things and services that estheticians can provide are such a nice complement to a dermatological setting and to a medical setting, and the treatments can really complement each other to get the best results. I actually was just talking with a patient just yesterday. We were talking about the health of her hair and her scalp and how she was dealing with some hair loss on her scalp as well as her eyebrows and eyelashes. And we were talking about maybe the possibility of recommending and incorporating some different supplements and lifestyle shifts. And then she had mentioned that a dermatologist had recommended that she do PRP for hair loss, which PRP, or platelet-rich plasma, is an incredibly effective treatment for hair loss. However, PRP is only as effective as the health of the blood of the person that PRP is coming from. So someone who does not have a whole foods diet, someone who's not taking supplements, someone who's not incorporating collagen, they're not going to get great results with PRP. So what I told her is I was like, go for PRP. Do that. Give it 6 to 8 months. Let's get you on a multivitamin first and start eating some whole foods and drinking good water. That way your body is going to be on a cellular level ready to give those blood cells to ultimately get the best results possible for treatment.
That's really interesting. So one of the things, and you mentioned the hair loss there, but then the specific areas of hair loss, which could be an endocrine issue as well. So outside of the skin arena, so obviously working with a dermatologist, you're working with an allopath whose specialization is the skin. And you talk a lot about supplements and dietary and things like that. What has been your approach, or have you in the past worked with, let's say, a naturopath or a dietitian or a holistic practitioner who could bridge the gap there between where your expertise and your scope ends and the care that client needs? What does that look like for you?
Absolutely. I'll tell you, I do a lot of collaborative work with dietitians and health coaches. I think because diet, when you're approaching the health of the skin, is key. And I think something that is really important for estheticians to do is to stay in their lane. Unless you are an esthetician who is also a dietitian, a functional nutrition coach, or something of that regard, we can talk about diet and food to a point. But I think there is a point where you need to get a credentialed professional involved, especially with food. I do a lot of work with dietitians. Something that I love to do as well with first-time clients who are really interested and invested in making a change for skin and body health is we make sure that there's no food allergies. Usually working with a dietitian, we will incorporate some type of gentle fast to incorporate getting blood and body moving kind of internally and getting things start to shift, and then move into some detox work, which is multifaceted.
Yes.
Yeah, and I think that's something I think that is a very nice compliment. I do a lot of work with dietitians and nutrition coaches. Absolutely.
Excellent. So that brings us then to this surprising service that you offer to a specific part of our population, and that is osteologic oncology care. Share with the listeners what that is and what you offer for clients that might be searching for that kind of skincare.
So for the people that know me personally, they'll know that my skin is incredibly sensitive. I feel like when it comes to sensitivity, that is where there is a gap in the aesthetics industry. Sensitive skin is unpredictable and highly reactive. And the people who have sensitive skin, not only are they dealing with physical discomfort and pain, but also emotional discomfort, because we live in a world that unfortunately judges people for their external appearance. You know, someone who has eczema or psoriasis, who has that covering 60-70% of their body, they're going to get judged, and people are going to make assumptions about what's going on with their body, regardless of knowing the root.
Right.
So my specialty within the field of aesthetics is oncology and sensitive skincare, and simply because I want to be the type of provider that I wish that I would have had when I was dealing with my skin sensitivities. It is a field within the aesthetics industry that is not very common or popular, I think because it's not glamorous. This is the side of the aesthetics industry, I think, that requires a special type of temperament. This is not something I think that can be taught in a textbook or obtained through state licensure. This type of work, I think, has to come from the heart of a person who really believes in the power of transformative aesthetics and the art and science of osteology. You have to be not only well-versed in how to take care of someone who has an incredibly compromised skin barrier, maybe who does not have a healthy functioning wound healing cascade, who is having emotional needs as well, and be able to balance this all delicately. Holistic aesthetics is very interesting, I think, because you're taking a multifaceted approach, and when it comes to sensitive skincare and oncology care, it is a multifaceted approach that is completely different than anything mainstream aesthetics.
And for our listeners who are not familiar with the term oncology, that has to deal with cancer care.
we're talking about you working with patients who are currently receiving chemotherapy or radiation. All right. So how does that differ for that client? You mentioned about the compromised internal system. Walk us through that, and what does that look like for you and for the client?
So I think for the clients of mine that do have sensitive skin, we have what's called a skin barrier. A fun fact is that healthy, unbroken skin is the body's #1 defense against pathogenic disease-causing bacteria. So when we have a healthy, functioning top layer of skin that has a certain level of acidity to it, which is between 4.5 and 5.5 on the pH scale, when we have that skin barrier that's intact, that helps keep the body healthy, and that's its first line of defense. Usually someone who has sensitive skin, someone who is going through active cancer treatment, they will have a compromised skin barrier. So when we use the term in the aesthetics industry, compromised skin barrier, what that means is that the acid levels of the pH of the skin are out of balance, whether they're more acidic or more alkaline. And it's when that pH is out of balance that we start to see unpredictable reactions of skin and inflammation. For some people, that could look like, they try a new lotion or they splash water on their skin and they get incredibly sensitive and red and hot to the touch. For others, that might mean that maybe they have sensitivity or reactivity to exfoliants. So for an oncology approach to skincare and an approach to sensitive skincare, that first and foremost come down to product and product formulation. Generally, a provider who is specializing in oncology skincare or sensitive skincare, they are going to be using products that are free from synthetics, fragrances, and artificial dyes and colors and lakes. Ideally, for a compromised skin barrier, someone who is going through a health journey, you want to have organic. Everything in my practice is organic, biodynamically and sustainably grown. It is radiating with life force energy, and the majority of it can't be eaten, which doesn't always taste good, but it's good for the health of the body. So I think that's something to be really mindful of when working with sensitive skin, is you want to have the least amount of stimulation possible. And with oncology care, that also includes not working with devices. A lot of estheticians will work with, treatments like microdermabrasion or dermaplaning. Maybe they'll do nano infusion. Someone with a compromised skin barrier cannot handle treatments like this because some of these devices, while they do great things for the correct person, someone who has a compromised skin barrier, their body cannot handle manipulation like that. And one thing I think that is different with an oncology approach to skincare is this discussion of the wound healing cascade, which I know that we touched on briefly earlier today.
Yeah.
I think when we're stimulating these treatments in the body, with the hope that with introducing a micro wound or a micro trauma into the skin, we're going to encourage the body's wound healing cascade to begin, which ultimately is going to encourage the production of collagen and elastin, which is going to give us beautiful, radiant skin. That's one of the benefits of estheticians and aesthetic nurses doing treatments like this. However, cosmetic treatments like this are only effective if the body is able to keep up on a cellular level. And someone who has sensitive skin or is going through active treatment, their wound healing cascade is not going to be there. Right. And if their wound healing cascade is not there, the results that they're going to get from that treatment is not going to be great. And sometimes it could even do more harm than good.
Yeah. So we were having, a nice in-depth conversation about this earlier. And I think that's an important thing for people to understand. The ability for the body to do the healing and the repair, right? And the regeneration, cleansing, repair, regeneration, these are natural responses of the body. We do it all day long. Every cell in the body has a lifespan. And what gets missed often in any kind of care routine, and I think especially in this one, is that when you have a body that is already bombarded with the need to do those three things, there's a finite amount of energy and resources available to do that. And if we try to ask the body to do too much too fast, we're going to cause harm. That's great. So you talked about skincare products and how some of them are not effective and not appropriate for sensitive skin because of how it changes the dynamics of the skin. And you specifically talked about pH in there. So can you share a little bit about what, like, off the shelf, drugstore, big box store skincare products typically do to the skin, and particularly like the skin barrier and the pH of that your products don't? What happens when we use those to our skin, right? And then how do your products differ?
I feel like cosmetic formulation and product selection needs to be its own podcast episode because I think there are so many different types of products and categories of skincare and cosmetic products out there. And I think it is intentionally done so strictly for marketing. Truly, the whole reason why estheticians have the work that we do is simply because we are the way showers to help guide these waters, because we don't know right now if we're supposed to do a 12-step skincare routine or a 3-step. There's so much confusion and misinformation, and that ultimately I think is what the marketing component of the beauty and wellness industry is trying to capitalize on. It's creating mass confusion, so people don't know what to do. Therefore, they're going to purchase more products to create an issue that's caused by another product.
And I've thought that myself for so long. There are so many different products out there, and there's always new stuff coming out, and now the collagen products and all of that, which is interesting to me because we produce collagen.
Yeah.
We do not absorb it. Like, no matter how much you put on your skin, it's not going to increase your collagen. Your body has to do that work. And so we need to get to the root of the problem.
Oh my goodness, yes.
And there are hundreds of products out there like that. And you're like, well, what's that supposed to do? And all you have to go on is the marketing.
Yep.
Yeah. Interesting. So again, I want to get back to, like, what is the effect that these off the shelf kind of, fast fashion, if you will, products have on our skin as it pertains to, like, maintaining the pH balance and the other factors that are really important to having healthy skin?
Yes. Oh my gosh. So I feel like the primary difference between a licensed esthetician and the skincare that they use in their office versus the skincare that is available in the drugstore is the quality and the concentration of ingredients. Something that I hear oftentimes when it comes to estheticians is, oh, that's a luxury service. I can do my skincare at home, which you can. But the caliber and the quality of the products that you're using at home is not half the caliber and quality of products that your licensed esthetician is using with a professional skincare line.
Yeah.
The majority of skincare products and cosmetic products available in drugstores, cosmetic suppliers, they're going to be full of synthetic fragrance, which too many things to say about synthetic fragrance: aggravating sensitivity, disrupting hormones, causing inflammation and irritation on superficially as well as internally. You're going to have synthetic fragrance lakes, pigments, and dyes, which are incredibly disruptive and abrasive. You're also going to have inorganic materials that can be used to abrade or exfoliate the skin, scratch, cut, or tear the skin. And if these are skincare products, we also have cosmetic and makeup products as well, which are packed full of these same dyes, fragrances, and silicones. All of these things with repeated, consistent use multiple times a day, makeup worn every single day, that adds up. And our skin is the body's largest organ, and the skin is the last organ to get nutrition, because our body is going to funnel that nutrition to our internal organs first that are going to keep us alive and thriving. So when we're trying to take care of the skin, my core belief is that you cannot have healthy, vibrant, glowing skin if you don't have a healthy, vibrant, radiant inside. And the products that you're putting on your external surface, it needs to be as high caliber and as high quality as the food that you're putting into your mouth.
Then we need to examine, like, what are we putting into our body as well, because that, from the inside out, has such a huge impact as well. We're going to have to take a break here in a second, but before we do, can you give our listeners 3 things they can do today to improve the quality of their skin?
Easily, yes. 3 things that somebody could do today to transform the health of their skin. First and foremost is drink more water. I say it all the time. You don't have to get crazy. An extra glass, an 8-ounce glass of water every single day is going to do you so much good. 2, sleep. We all need to sleep more for so many reasons. Sleep more. Sleeping more good, high caliber sleep is going to help rejuvenate your body and your mind. It also gives yourself time to repair. When we're talking about skincare, our fine lines, our wrinkles, our pores, our pigmentation, it didn't get there overnight. It's not going to go away overnight. However, during the night, We can use different topical active ingredients and skincare products, get a good quality sleep and rest, and give our body a moment and opportunity to set the stage so it can repair and heal. Third final thing I would say is consider taking a very simple approach to skincare. Unless you are working with a licensed skincare professional, keep it super simple. A simple everyday skincare routine is going to be a nice cleanser, wash your face twice at night, simple moisturizer, whatever feels good, and SPF or sun protection, period.
So that brings us to the uncomfortable truth segment of our show, part of the show where we share truths that might be hard to hear, might even make you a little uncomfortable, but hopefully encourage your creative problem-solving juices to get flowing and empower you as you continue on your personal wellness journey. Sometimes you have to be selfish to take good care of you. No matter what products or services you're using to care for any part of you. The most important and effective care is the care that you provide for yourself, making sure that you are eating well, being active, getting enough sleep, and taking time to recharge are vital to your wellness, mentally, physically, and emotionally. I have to take one final break, but when we come back, we're going to learn about some common conditions that you might not know an esthetician could help you manage. So stick around, we'll be right back.
You're listening to Tea Time with Dr. Danni, conversations for navigating holistic medicine and wellness. Stay tuned, we'll be right back after the break. Are you in or near the Youngstown, Ohio area? Do you want to learn more about herbal medicine and how to make them? Then check out Dr. Danni's Deep Dive Herbology series in 2025. Deep Dive Nettle takes place June 19th and 26th at the classroom located at 755 Boardman Canfield Road, Suite C2, bottom floor. This 2-day immersive class dives deep into the uses, properties, and ways to prepare every part of this incredible plant, often mistaken as a common weed. You'll learn the benefits of each part of nettle, receive hands-on activities for you to do at home, enjoy interactive classroom activities, and receive recipes and activities to continue exploring the wonders of the nettle plant. Just $90 covers both days and class supplies. Registration ends June 13th, 2025, so call today to reserve your spot. Call 330-758-9567 or text NETTLE, NETTLE, to 234-308-8289. Or check the show notes for registration info. For up-to-date workshop and appearance information, go to www.drdanninaturopath.com/education. The Classroom, in collaboration with Dr. Harriet Lemberger Shore, is proud to present Introduction to Collaborative Medicine on August 17th from 9 a.m. to 4 p.m. at 755 Boardman Canfield Road, Suite C2, bottom floor. This retreat coincides with the kickoff of our 100-day challenge and will introduce you to the different aspects of collaborative care with breakout sessions on lifestyle medicine and vision setting, naturopathic medicine and nutrition, emotional healing and rebalancing, and the transcendence therapy, followed by activities and a cooking demo. A light breakfast will be provided as well as lunch following the cooking demonstration. The cost for this retreat is just $65 and registration is now open, but seating is limited. Registration closes August 12th, 2025. Call 330-758-9567 or text COLLAB to 234-308-8289 to reserve your spot today. You're listening to Tea Time with Dr. Danni. This show was previously recorded. You can reach the show at drdanninaturopath@gmail.com. That's DRDANNI naturopath@gmail.com, or find the link in the show notes below. Now back to tea time. Here's Dr. Danni.
Welcome back, Tea Timers. Before the break, we were discussing how estheticians can be an important part of your health and wellness team via collaboration and how estheticians can help during cancer treatment and recovery. This has been such a great conversation. I want to share with our clients, though, some information that they may not really know about your field. So what are some common conditions that our listeners might not realize someone in your field help them with, or what does that look like?
I would say the big one would be sensitivities and sensitive skin. There is so much relief and treatment available for someone who has sensitive skin. And I think as someone who has, to this day, sensitive skin, we're kind of just told that this is the way that we are and we just have to deal with it. And just manage our symptoms as best as we can. And there is so much relief for sensitivity. If your skin is burning when you introduce anything other than water to it, your skin barrier is compromised. And I'm telling you now that there is relief to be found. I feel like rough skin and tough skin on the face and the body as well. Sometimes we'll call it that chicken skin on the back of the arm or the legs. Very treatable. I think things as well like inflammatory conditions of the face and body, as well as the popular cortisol phase, which is something that everyone's talking about right now, that excess puffiness. Estheticians who are trained are able to help with that too. And something that I think is kind of a not common service, but brightening of the skin. Sometimes we can have dark shadows in the underarms or in the genital area, which can come from a lot of toxic buildup in the body, as well as someone who has more melanin in their skin might also have some post-inflammatory hyperpigmentation or things like that. Intimate brightening and brightening of the skin is something estheticians can do as well, depending upon the cause of the pigmentation, whether it's has to do with toxins building up in the body. We can help do services to help detox and brighten the skin naturally. There's also services, skin bleaching as well, that estheticians, as long as it's in their scope of practice within their state, can do so too.
Excellent. So you wear a few hats.
Quite a Renaissance woman, some would say.
And so you have a background in fitness as well.
Yes.
Yeah. So let's just talk a little bit about that work. Tell us a little bit more about that, and why is that so important to you?
Oh, yes. For my whole life, I feel like I have always felt the most alive when I'm moving my body. It is when I feel the most vibrant. It's when I feel the most strong. It's when I feel the most impactful and energetic. And I think my journey into fitness and wellness has just been such a core part of my life since I was a teenager. It has really showed me what embodiment in my body looks like and what that feels like. I grew up very traditionally, and those who knew me when I was young, I was quite shy and quite reserved. So if you would have told me then what I'm doing now, teaching group fitness classes, teaching Zumba classes, shimmying in front of rooms, full of 30 to 60 people, oh my gosh, you couldn't have told me.
Yeah.
I think that fitness is so freeing and so liberating, and it all comes back to being embodied in the body.
That's a really cool point that you make, that, that it's about fitness, not about exercise. And you're really just moving the body. And it doesn't have to be like some grueling routine. It can be something that really brings you joy and actually helps to recharge you.
Yes, I very much believe that fitness needs to be functional. I always say I'm not trying to have a six-pack. I'm not trying to get, the two-piece bikini body. I'm trying to have a functional, healthy, strong body that can carry me through every season of my life. I know that my body will not be as strong, as healthy, or fit as it is today, and I'm trying to use every tool that I have in my toolbox to help me stay that way. And a big part of that as we age is regular movement.
Yeah, very much so. I'm unfortunately, I'm decades in, and finding that the things that I did even 10 years ago, I struggle with, and mostly because I have spent quite a bit of time not doing those things. And what's interesting, I don't know if you find this or not, but I used to teach belly dance. I taught a beginner class, way back in the day, 2008. And I loved it. It was probably my favorite form of movement. Now, don't get me wrong. I did I did Zumba, I did kettlebell, I did all that stuff. But when you find something that you really love and speaks to you and frees you, that when you don't do it, you miss it. If you could give our listeners one piece of advice about their wellness journey, what would it be?
I would say body strong, serve long. The stronger, the more radiant the body is, the longer you're going to be fit enough to be able to be of service to other people.
So we're almost out of time. And before we go, tell our listeners how they can find you.
Oh, yes. So my full name is Mikkel Mimo. My practice is Guided Compass Holistic Health. I'm based out of Youngstown, Ohio. I am on social media, the little @ symbol, Guided Compass. And my website is www.guidedcompass.org.
Excellent. Thank you so much. It's been wonderful having you here. We will have Michaela's contact and business information in the show notes for anyone who would like a physical copy of that. I appreciate you coming on the show and sharing about your field and your approach to your field. It's been such an eye-opening and learning experience for me. I hope our listeners are enjoying it as well. I'm sure they will. Until next time, thank you so much.
Oh, Danielle, this has been truly my pleasure. Thank you for giving me the opportunity to come and talk about the field of aesthetics with those listening. There is so much work that this industry can do that complements the field of naturopathy so wonderfully. And I think it's amazing that you're giving us an opportunity to speak to it because so many people can benefit. I know it to be true.
Thank you. Thank you.
We have arrived at the moment of clarity part of the show where I share thoughts designed to inspire you to think critically and empower you to take action. You can lead a horse to water, but you can't make them drink. That old adage that holds so true for each and every one of us. You can give someone the tools and resources that they need to help them progress, grow, and improve their life. But until that horse decides that it's thirsty, it's not going to lean down and drink. We can't make anyone do anything until they are truly ready to do it. Take a moment to assess the tools that you have in your life and what you may be holding yourself back from utilizing that would propel you forward on this journey that you're taking and help you to arrive at your next best self. That's it for today's show. Please join us back here in the parlor in 2 weeks for our next episode where we will be talking to chiropractor Dr. Pat Ensminger. Dr. E is going to share some interesting benefits of chiropractic in collaborative care and a surprising application of that field in addiction prevention and care. You can get more information on me, Dr. Danielle McDuff, at www.drdannynaturopath.com, including upcoming workshops and speaking dates on the Education tab. You can also purchase swag and books at the website at www.drdannynaturopath.com/shop. Go to www.musslerchiropractic.com to book an appointment with me or any of our providers, or call 330-758-9567. You can find me on Facebook and Instagram under the handle at Phoenix Dr. Danni. That's PhoenixDranni. And join the Tea Time Facebook group at Tea Time with Dr. Danni on Facebook, or check the show notes for all the links and contact information. That's my time for today. Until next time, my lovelies, remember, be kind to each other and be kind to yourselves. Thanks for joining me on Tea Time with Dr. Danni, conversations for navigating holistic medicine and wellness. This show drops every other Thursday at 6:30 p.m. Eastern Standard Time. Join us in the parlor for another episode of Tea Time with Dr. Danni in 2 weeks. And don't forget to like, share, follow, and subscribe to be the first to know when a new episode is available. The information and views expressed in this show are from a naturopathic viewpoint, and the content is educational information regarding the topic discussed. The underlying cause of any condition for any person may have some overlap with the information provided in this show, but will always be more nuanced than any bit of general information and require you to dig deeper with your team to discover the full cause for you as an individual. The information in this show is not intended to diagnose or treat any ailments.